Welcome to the Libido Lounge, where we focus on all things love, lust, and libido. We believe that fabulous sex is important to health as exercise and good food. Hey everybody, welcome back to another episode of The Lounge. In this episode, we're talking about all things hormones. And as we begin this conversation, I want to start by saying that one of the most common things that happens when I tell people I'm the libido doc is one of the first responses most people say is, "Oh, so you do hormones." And I'm bringing this up right now because as we go into this hormone discussion, I want to be very clear that we're talking about low libido, low sex drive, and we're talking about how to maximize and improve our libido. Hormones are a vital thing to consider. And it's very, very frequent that low hormones or hormonal imbalances are only one piece of the puzzle. So I'm just bringing this up because, like I said, it's very, very common that as soon as people hear I do libido, they think hormones, but they don't think about the fact that it's also cardiovascular system and neurological system. It's also our emotions. It's also safety. It's also interrelational with a partner. It's also how we feel confident in our body image. It also is related to dopamine and motivation. It's what we've been told socially and culturally about sex. So there's so many things wrapped up in here. But of course, we do want to talk about hormones. So there's a few things I want to go over as far as hormones, and I want to break down some of the myths that are out there around things like hormone replacement therapy and actually make some really good cases for why hormone replacement therapy is very, very important once you've reached the menopause age. So wherever you are in your cycle or post-cycle, it's something that is important to understand is if you're having symptoms of hormonal imbalance, which could be as simple as a low sex drive, many other symptoms oftentimes are present, but if you're having symptoms of low sex drive or of hormonal imbalance, oftentimes the tests that are done are not very thorough, right? So oftentimes we do tests in conventional medicine, such as a total estrogen level. We actually have 3 different types of estrogen known as E1, E2, and E3. They all do different things and they are predominant in different amounts at different points of our lives. So premenopausal estradiol known as E2 is the most potent. Postmenopause estrone known as E1 is the most predominant, right? So they change and they do different things in the body. And oftentimes only total is run. But let's say you're a premenopausal woman and you run your total estrogens and they come out normal. But let's say you have a really, really big amount of E2, which is the most potent form of estrogen, and really low amounts of E1 and E3, which are much weaker. And the total looks good. So you're told by your doctor you're fine. But because what you have almost predominantly in this example is E2, what that means is the impact of estrogen on your body and on your cells is basically like you have too much estrogen, right? So that can cause things like acne, PMS, mood problems, and so many more things. It can also make you feel irritable and not super sexy. So if this is the case, this would be missed by conventional labs. Another thing that I see is testosterone and testosterone not measured totally correctly. So testosterone is really important, not just for men, but also for women because it's a hormone that drives our sex drive. And it drives our sex drive purely because it impacts libido, but also because it helps with things like weight management, like muscle development. So oftentimes when we have good testosterone, we're a healthier weight, we feel stronger, we feel better in our body, more confident, which can come down and lead and trickle down to a good and healthy sex drive. So many times people, when their testosterone is tested, we only test total testosterone, which is the amount the body makes, which sounds really good until you understand that there's something called free testosterone, which is really the amount that your body is able to use. And so if you're just testing total, you could be making all the testosterone in the world that's super healthy, but you're not using it correctly. Now, a further downstream thing to talk about are the two major different types of testosterone. There's two major types of testosterone. One is a potent form, dihydrotestosterone. The other is a weaker form. And so essentially what can happen is the body can make one of these kinds more than the other. So if your body is making only the weak kind of testosterone and very little of the strong testosterone, then it's not going to be as strong of a testosterone impact. And it might look, if you only measure testosterone, it might look like you have enough, but you might not have the activity in your body that is the same as if you actually were having the strong testosterone. Conversely, if you have too much of the strong testosterone, this is where that things like facial hair growth can happen, where sometimes even hair loss can happen. So we can see that there's these certain changes that are not healthy if we have too much of the potent one. So you don't want too much, you don't want too little, right? And so conventional testing oftentimes misses this level of information. Okay, so beyond this, well, what do we do? Before we say beyond this, let me take a step back and say, what do you do? So it's really recommended that you would do a urinary hormone test. A urinary hormone test is going to be able to look at all the different types of estrogen, the different types of testosterone, the total, the available to your cells, progesterone, DHEA, we can't forget about DHEA. DHEA is that precursor hormone to estrogen and testosterone. It makes us feel super good. It's really important because DHEA classically declines as we age. It's been said in research to contribute to the aging process. And oftentimes I find that women, especially as they're reaching perimenopause or menopause, and they use DHEA oftentimes topically on their vulva. Oftentimes this really supports lubrication, can really help if there's certain levels of pelvic pain. It's not going to reverse all causes of pelvic pain, but it can really help in some situations. And it can also help so much with bringing blood and that lubrication to that erectile tissue. I've seen it really help women get their libido back. So DHEA is an amazing, amazing hormone, and these urinary hormone tests really work well for that. So you can find urinary hormone tests in my stores. So it's always an option for you is to purchase that direct to consumer. I don't find a lot of conventional docs order that for people. So I try to find ways of making it possible for you to get those sorts of tests. Okay, so now I want to talk a little bit about HRT and hormone replacement therapy and dispel some of the myths out there that people are getting so scared about. So I have talked about this on another episode, but I do want to come back to it just because this information is so crazy important. And one of the biggest things I want to impart on you is that if you are in that perimenopause or menopause age range, it is important to start on some of these bioidentical hormones ASAP. And I say that because there's this critical theory that we see in research, this critical time period where if we start on estrogen therapy, for example, right away, right as we're starting to lose the hormones, then we have amazing protective mechanisms for memory and for the cardiovascular system. But what we see is that if estrogen is not started on right away, if we wait 5 or 10 years, then there is a dramatic reduction in this hormone helping with things like cognitive function and with cardiovascular health. So estrogen really does a lot to support circulation. Estrogen does a lot to go to the prefrontal cortex and blood to the prefrontal cortex, send blood to the hippocampus, these areas of memory, of reasoning, of thought. So in order to keep the brain sharp and plastic and fluid, it's really important to make sure we are sending blood to these particular areas, right? So super, super, super useful, and estrogen helps with that. But if we wait too long, what we see in the current literature, in the current studies, if we don't start it fairly quickly, if we wait 5 or 10 years, then the effects go down dramatically. Now, there can still be benefits of starting, hormone therapy later, such as supporting libido, for example, supporting bones, but we get the most benefit for adding these hormones when we start start them right away. So I would really encourage you to start these hormones right away. This is a topic I'm super passionate about. I'm in my mid 40s, so I'm moving into this, this age. And it's one of the reasons that I'm super excited about studying this stuff is because what I'm really working to do with myself and with women I work with is to help people move into, midlife and crossing the threshold of menopause with ease and with a high libido and feeling more confident and more sexy and more full of wisdom and a higher body image than perhaps ever in their life before. And I really believe this is possible, but I really believe that hormones are supportive of this. So the other thing that I want to circle back around is the study on the Women's Health Initiative. And I say circle back around because I've mentioned this in a previous podcast. And I'm mentioning it now because I want to make sure that people hear this again. And I will say this again throughout, I'm sure, many episodes for months and years to come, because I think it's just critical that women hear this. And sometimes it's beneficial to hear these things more than once till we really understand them. So the Women's Health Initiative was a initiative designed to study women that started around 1991. Now, this was a beautiful, beautiful, beautiful idea, right? Because so many of the studies on hormones, but also on so many things in medical literature, are done on men. This is a huge problem, right? There's not near enough studies on women. So the Women's Health Initiative, amazing, amazing, amazing vision to help that particular cause, right? To help women and help more studies on women. However, the study on hormones that was done on multiple tens of thousands of women, the study on hormones basically was looking to say, okay, well, hormones safe, because hormones had been prescribed a lot throughout the 70s and the 80s, and there wasn't a lot of literature saying, well, is this safe or not? So the study really looked at a few different things. It was looking at cancer, it was looking at cardiovascular disease, and it was looking at mortality. And so essentially some of the problems with the study initially were, one, a lot of the women in the study were a lot older. We're oftentimes 15 years older than menopause. And so we're not looking at when it's recommended to start hormones. It was looking at starting hormones oftentimes 15 years later. And this was done because one of the things they wanted to study was mortality. And if they had most of the women at age 50 or less, then it would be a very, very long longitudinal study. And that, one from a funding perspective, and two, for like a standpoint of decades before the results were actually back. So essentially there was a problem with, they didn't actually start oftentimes it's recommended, like I'm saying, to start hormones right away. Well, and we're seeing, if you don't start hormones right away, we're seeing that there is a difference in how they perform in the body, right? So the study was not done in a way that we're actually recommending women to use hormones. So that's problem number one. Two, in research, there's this whole problem with exclusion criteria where we say, okay, we are going to exclude people from the study that meet these sorts of problems, right? So for example, this Women's Health Initiative study did not exclude for things like diabetes or obesity, which are linked to heart disease, right? So we don't have a clear baseline of like, oh, everybody in the study has a really equal health risk and they don't have these other types of conditions that could also be leading to things like heart disease. So another problem with the study right there. But one of the biggest things as far as how things were reported is the difference between what's called absolute versus relative risk. So I'm going to explain what this means. And this is really, I'm getting into the weeds a little bit. I'm giving you more science in this particular episode than I do on some other episodes. But I'm doing that because I think it's really important for you to understand this when you're making your hormone decisions for your libido, for your wellness, for your anti-aging, and for your brain and for your heart. So essentially what this study found, this study was done on, like I said, it's tens of thousands of people, but for simplicity, I'm going to talk about this from a 1,000 person point of view so you understand the math really easily. So essentially what the study found, if we were to break this down, the numbers down to only 1,000, it found that 4 out of 1,000 people had an increase in certain risks, like essentially breast cancer, heart disease, mortality, right? So 4 out of 1,000. So 4 out of 1,000 people say passed on, they died, or they had breast cancer, right? So essentially when they were, and that was no hormones, versus 5 out of 1,000 when they had hormones develop problems like breast cancer or mortality. And I am oversimplifying this for ease, but I want you to understand this, right? So that difference between, say, that 4 to that 5, we could say from a relative risk standpoint, for the relative means the 4 out of 1,000 versus the 5 out of 1,000. So 4 to 5, a change from 4 to 5 is a 20% increase, right? That's relative risk. When you gave hormones, there was a 20% increase. But absolute risk is saying, okay, when you gave hormones, only one more out of 1,000, right? That is less than 1%. Only one more out of 1,000 actually increased in these things. And I'm oversimplifying this because the numbers were slightly different when breast cancer was studied versus heart disease was studied versus mortality. But it's basically all around this 1 out of 1,000 or less is the risk, right? So that was largely what was found, is that you have this very, 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 very small increase in risk between the non-hormone group and the hormone group. But because the headlines read as 20% increase, then people were like, oh my gosh, hormones are so bad, right? So there's, many different things, right? This is not medical advice. This is information, but this is important for you to understand the study and how doctors are actually recommending this, because they're basing this on this 20% risk. But if you actually look and say, well, it's really not a 20% risk. What it really is for every 1,000 people, according to the study, there's 1 out of 1,000 that had one of these events studied: breast cancer, heart disease, mortality. 1 out of 1,000 increase. And that's not considering other factors. That's not considering perhaps how these hormones impact somebody with diabetes or obesity or all these other factors, really when we're thinking about them, right? All the whole accumulation of all these other factors. So, and we see so much data and so much value from a standpoint of brain health and heart health and how people feel, right? How their skin looks, their level of confidence, their level of libido, their level of excitement about life, their motivation. All of these things can improve with hormones. So, my general thing is like always with education. I'm an educator, doctor in Latin actually means to teach, is actually the translation of docere. So really that's what I feel like as a doctor, my biggest role is to educate people. And when it comes down to the education, then of course, as a listener, as a human in this world, as somebody that is looking for medical support and libido support, it's ultimately your choice what you feel is the right situation for you for handling these sorts of questions. But I feel like my job is really to help educate you and help dispel some of these myths, help you understand the research, help you understand how these studies are conducted, how these stats are determined, so that then you can decide based upon all of this information what is actually the right way for you. So I hope that helps. I hope you will continue to leave comments and questions. And, like I said, this is a very controversial topic. So I do appreciate any sort of questions you have, anything you guys need that you want additional clarification on, please let me know. And this has been another episode of The Lounge. Thank you again for joining. Thank you again for subscribing. This is Dr. Diane reminding you to stay classy, stay sexy, and stay a little badassy. Thank you for listening to the Libido Lounge. Please don't keep me a secret. Please share this with your friends. You can find me on YouTube, on Instagram, as well as how to work with me at mylibidodoc.com.